Hi everyone, so welcome back to my channel. I am so excited because my lighting is fixed. You can see me clearly in this video. I'm so happy. My lighting has been broken for about the last 2-3 videos, possibly 4, possibly. But I finally got it fixed. My friend fixed it for me. I'm so excited. So I haven't done any beauty videos or product review videos because my lighting has been broken. I felt like you guys wouldn't be able to see the swatches clearly or the products, so I've just been holding off on doing them until I could figure out what to do with my lighting. But now that it's fixed, be on the lookout for some upcoming beauty videos. As far as this video goes, I made a video last week on hookworms explaining what they are and how people get them. So for this video, I'm going to be explaining preventive strategies, so how to prevent getting a hookworm infestation, as well as the current treatment methods available to treat hookworms. So that's what this video is about. So I hope you guys enjoy this video. So let's just get straight into the video. How to prevent a hookworm infestation. Number 1. Wear shoes and take other protective measures to avoid skin contact with sand or soil. Travelers to tropical and subtropical climates, especially where they have exposure to beaches, should be advised to always wear shoes and use protective mats or other coverings to prevent direct contact with sand or soil. Number 2. Don't allow children to play in the dirt or to eat it. Number 3. Don't use human feces as fertilizer. Do not walk barefoot in areas where hookworm is common and where there may be fecal contamination of the soil. Avoid other skin to soil contact. Fecal contamination occurs when people use the bathroom outdoors or use human feces as fertilizer. The infection of others can be prevented by not doing either of these things and by disposing of trash, sewage, and fecal matter appropriately. Number 4. Keep pets away from babies, infants, and small children because they are fragile and more susceptible to illness and disease. Control where your pet goes to the bathroom. Clean up after them. If they go to the bathroom outside, pick it up using a bag to protect other people and children from contamination. Use good hygiene. Teach children to wash their hands after playing and before eating, as well as after playing with their pet or petting them. Do not let children play in areas where dogs or cats have gone to the bathroom. Do not allow cats to use sandboxes or the garden as litter boxes. Animals should not be allowed to use the bathroom on beaches. Number 5. Wear gloves, shoes, and protective clothing when gardening. Number 6. Don't sit directly on the ground. Use a tarp or other barrier such as a blanket when sitting on the ground. Number 7. Deworm and treat pets for parasites regularly. A common question is, can I get hookworm from my pet? Yes, puppies and kittens are especially likely to have hookworm infections. Animals that are infected pass hookworm eggs in their stool. The eggs can hatch into larvae, and both eggs and larvae may be found in dirt where animals have been. People may become infected while walking barefoot or when exposed skin comes in contact with contaminated soil or sand. The larvae in the contaminated soil or sand will burrow into the skin and cause the skin to become irritated in that area. Routine veterinary care of dogs and cats, including regular deworming, will reduce environmental contamination with zoonotic hookworm eggs and larvae. Prompt disposal of animal feces prevents eggs from hatching and contaminating the soil. All newborn kittens should be treated from ages 2 to 3 weeks of age for parasites. To break the cycle of the most common intestinal parasites effectively, your veterinarian will recommend a schedule that is appropriate for your kitten. Prompt treatment for worms should be given when any parasites are detected. Periodic routine deworming may be appropriate for cats at high risk for reinfection. Use of a monthly heartworm preventive that also prevents hookworm infection is highly recommended. Here are some tips for you. Appropriate disposal of cat feces, especially away from yards and playgrounds, is very important. Strict hygiene for children is also very important. Do not allow children to play in possibly contaminated environments. Be mindful of the risk posed by public parks and non-covered sandboxes. Control of rodents is also important since they may play a role in transmission of hookworms to cats. So make sure that rats and mice are not around your home or even outside where your garden is or behind your house. Stool should be removed from litter boxes daily if possible, and always wash hands after handling fecal material. Deworming your pet is the best way to prevent a hookworm infestation in your pet as well as yourself. We must not forget that fecal matter left by a pet that has a hookworm infection is very contagious and it should be removed immediately. Another option is to dust the area with a common pesticide to kill any leftover germs from the fecal matter. You could also use a natural pesticide as well. Hookworms live in your dog's digestive system. They must be diagnosed by your veterinarian. Keeping your dog's environment clean and keeping your dog away from contaminated areas are the best steps for prevention. Dogs and puppies should be examined regularly for hookworms. Puppies should be treated for hookworms at 2, 4, 6, and 8 weeks of age with a deworming medication. This frequent treatment schedule is recommended due to the very high rate of hookworm infection in newborn puppies. Fecal examinations should be conducted 2 to 4 times during the first year of life, and 1 to 2 times per year in adults. Nursing mothers should be treated along with their puppies. Number 8. Understand who is at risk and where infections occur most. Certain people are at greater risk than others, such as plumbers, people with pets, people who work with pets, and gardeners. People living in areas with warm and moist climates and where sanitation and hygiene are poor are at risk for hookworm infection. Be careful when traveling to tropical, subtropical, or developing countries because these places have high incidences of hookworm. People who have contact with the ground, especially for long periods of time, like plumbers or electricians working in crawl spaces, should put a material between themselves and the ground. This is why hookworm infestation in people is sometimes known as plumber's itch. Sunbathers, especially those lying on wet sand or ground, may also be at an increased risk of becoming infected. Almost 70% of the people who may be infected won't be able to tell they suffer with hookworms because most people infected do not show any symptoms. Thankfully, the hookworm that infects humans cannot survive in any climates other than tropical or subtropical. So if you live in desert, dry, or polar tundra climate regions like Antarctica, parts of India, and parts of Egypt, you won't likely get hookworms because the climate there makes their babies unable to hatch and survive, since it is either too cold or too hot for them there. Hookworm infections are a worldwide problem, especially for those who are poor or have low socioeconomic status. It has been estimated that 576 million people around the world are infected. The regions of the world that are most infected include Sub-Saharan Africa, the Pacific Islands, India, East and South Asia, Latin America, and the Caribbean. Hookworm is also very common in the United States. Some parts of the United States have more incidences of hookworm than other parts. So how is hookworm treated today? Hookworm is treated today through drug and prescription medications, but there are natural and homeopathic options available as well. Hookworm infections are treated with anti-parasitic drugs, such as albendazole, which is taken by mouth. However, because of negative side effects associated with these prescription medications, pregnant women cannot take them. So pregnant women should consider more natural options for killing the hookworm infection. In general though, the two main drugs of choice that are given to treat hookworm infections, especially in humans, are albendazole and mebendazole. The infections are usually treated for 1 to 3 days, and these medications generally have fewer side effects. In addition, iron supplements may also be given if the person infected develops anemia because of the hookworm infestation. Blood transfusions are also given if the person develops hemorrhaging or chronic anemia because of the hookworm infection. So the secret to treating hookworm infestations is killing parasites. You need to kill the parasites in you and your pet's body. Supportive treatments are also given to treat hookworm, such as electrolyte and fluid therapy, and a high-protein diet. Here are several medications that are given to treat hookworm infections in pets. Along with pregnant women, if you are someone who wants more natural options or are concerned about the side effects associated with these prescription medications given to treat hookworm, then another option is to contact a natural or holistic doctor that you know and trust and ask them for a recommendation for a good parasitic remedy to kill hookworm. Because even though there are a lot of parasite killing remedies online, such as Amazon and eBay, many of them contain parasites themselves, so they can do more harm than good. So asking your doctor about less harmful medications is best, or asking a natural doctor what they might recommend on the market that is safe to take. Even though a hookworm infestation can be a devastating illness, it is preventable and treatable as long as it is caught at the early stages. So make sure that you are aware of changes in your body or your pet's body so that you can treat hookworm quickly and effectively.